Hi, everybody. So, I put up a post asking people if they would like me to do a meditation for dealing with chronic illness or incurable type of diseases or chronic progressive diseases. And quite a few people said yes, they would like it. But I think what we need to do first is talk about the emotional impact or the mental impact of being diagnosed with a chronic often progressive and sometimes incurable disorder or disease. Um, I myself am one of those people. I went down a long diagnosis journey. I call it my merry-go-round of specialists because I felt like I saw almost every specialist you could possibly imagine until I finally got the right diagnosis. But my diagnosis journey began about 15 years ago. Waking up one night and I could not see out of my left eye. I literally went to sleep and I woke up around 2 or 3 in the morning, and it was as if somebody took a black piece of construction paper and went like that. And I remember a couple of hours later seeing these little red triangles that started to appear. And I was like, oh, maybe my vision's coming back. I kept going into the bathroom and looking in the mirror and opening and shutting and opening and shutting and thinking, oh, by the morning it'll be back. Maybe it's just a migraine. In the morning it wasn't back, and it never came back. I got a little bit of faded vision from it. Like I could see some color every so often. I could see some blurriness every so often. But I have no functional vision now in that eye. Um, I started having problems walking. I started having problems from my left side to my right side. And my doctor said, I'm pretty sure you have MS. And sent me to a neurologist. And the neurologist said, pretty sure you have MS. You have all the classic symptoms of it. I had something called optic neuritis, which is inflammation on the optic nerve. When I went in to see the doctor, and they gave me a 5-day course of IV steroids, a gram a day, 1,000 milligrams. Whew. Very strong. It treats your symptoms, it gets them better, but it creates a whole different set of symptoms in your body and your emotions. And that was the beginning of my journey. Many MRIs, 5 spinal taps, 3 of them because insurance companies said, we're not paying for that medication unless you prove she doesn't have some other disorder. I had a spinal leak where my cerebral spinal fluid was leaking out of where they did the tap because I sat up too soon afterwards instead of laying flat. Um, I did different types of medications when I lost my vision. One of them caused me to get aseptic meningitis, which means that I had a break in the blood-brain barrier, not the bacteria got in there. That was excruciatingly painful. I went through a very long journey. My family went through a very long journey. And with my first spinal tap, my doctor looked at me, who was not my normal doctor. He did the surgical procedure. He said, I'm pretty sure you have something called Devix or Devix disease or neuromyelitis optica. And I said, what is that? And I went home and I looked it up and I was like, whoa, I do have a lot of symptoms of that. Well, it took me another 10 years before I got diagnosed with that. They kept telling me I had autoimmune disorder, I had MS. I had MS, but not a typical form of it. And then finally, when I lost my vision in my right eye, and much testing and much examining, I was diagnosed correctly with exactly what the other doctor told me, NMO. So, when this happens, when you're sick, all you want is an answer. You want a diagnosis. Everything they give you, your bills that come back from the insurance, you look and see what diagnosis they put down to bill you out with. You research Google, it becomes your best friend and it also becomes your best enemy. You become a master at medical terminology. I am a nurse, so when I went in and I discussed my symptoms, they took me seriously because I used medical terminology. But when an everyday, average, non-medical female goes in and says, something's wrong, I just don't feel right, something's wrong with my eyes, I'm kind of tripping every so often. And then they do the first set of tests and they can't find anything wrong. They say, how's your stress level? You might want to go see a therapist. When a male goes in and describes these symptoms, quite often every test under the sun gets done and they get diagnosed. When I first got sick, the average diagnosis for a female with MS was 7 years after a male upon presenting symptoms, because women are considered more histrionic, more dramatic. It's all in your head. But because I had the good fortune of being in the medical field, I knew what I was talking about and how to phrase myself, so the doctor took me seriously from day one. Nothing against doctors, not by any means, but it's a pretty well-known thing within the medical community that the men get treated much faster than the women. They're taken more seriously. All right, so now you go through a period of, I need a diagnosis, I need a name, I need to know what's wrong with me, and that's what you're begging for. And then they give you that name. And then you go, wait, maybe I don't have that. Maybe it's wrong, because when you fully research this title they just gave you, that you've been begging for, you don't want it. You don't want to read incurable. You don't want to read chronic or progressive, disabling, possibly fatal. Life expectancy after diagnosis, prognosis, outcome. These are all words that you didn't think about before you got diagnosed too often. And then you have to tell your family, who knew something's wrong. They're all waiting for an answer. And then you get one and you don't want to tell them. I remember not telling my family at first, because when I was first diagnosed, it had a 5-year prognosis. Now it's different. Now you can live your whole life as long as you don't have severely debilitating attacks on your spinal cord where your breathing is. But you start saying, I wish I was the old me before diagnosis. I wish I was the old me before I got diagnosed with anxiety. I wish I was the old me before I got diagnosed with diabetes. I wish I was the old me before I got diagnosed with MS, Hashimoto's, thyroid disorder, psychiatric disorders, anything, any disorder that you're going to have the rest of your life. And that's one of the biggest things that I work on with people is, you don't want to become the old you, the misinformed you, the scared you, the fearful you. You want to become the new you that learns how to manage your disease without becoming the disease. When somebody gets diagnosed with cancer, we don't say they are cancer. When somebody gets diagnosed with a cardiac condition, we don't say they are a heart attack. But when somebody gets diagnosed with a psychiatric disorder, we say they are bipolar. They are schizophrenic. Why do we do that? Why do we make them become the disease? How hard is it to detach yourself from a diagnosis when you become that disease? When I was a psychiatric nurse, I worked on this a lot, that the disease is a part of you. You are not a part of the disease. It's just a fraction of you, but yet it can encompass your entire life. And as soon as you allow yourself to become the disease, you're done. You lose all motivation. You lose all your will. You no longer feel at all like the old you. But you also don't like the new you. And you literally go through a grieving process. You don't know who you are anymore. You feel like a stranger in your own body. And quite often, your body betrays you. I remember falling down so much that my kids got so used to it, they could just step right over me. Everybody knew that I would kind of, lag back a little bit. I would laugh at certain things I did because I would go to pick up something and go to pick up a cup and immediately go like that because I couldn't hold it. I couldn't tolerate heat, so my son would be playing baseball and I would go and sit in a shady spot, and then I'd have to spend the entire night in bed because I couldn't walk properly, or my vision would be so extreme that I couldn't really walk around. My medication treatments would put me in bed for a while. They make me gain weight, a lot of weight. And when you have a disorder that takes away your freedom, your mobility, your independence, the last thing you want to be doing is gaining weight and starting to look different as well, feel different, and then they start affecting your thought patterns. A lot of the medications affect your emotions, and then you start looking at your family members and you don't want them pitying you, so you push them away, and now it's affecting your relationships. And then there comes a point where you say, no more, no more. The sad part is some people don't get to that point, and they succumb to their disease mentally, emotionally, and physically. But if you can get to that point and say no more, and say, I'm going to be the new me. I don't want to go back to the old me. I want to be the informed me. I want to be the healthier me. I want to educate my friends and family and loved ones to understand what the process is and what I'm going through. I want to enable myself to do what's best for me. I want to be able to do things on a more stable, consistent level without exhausting myself or putting myself in a hospital. I went through a period of like 2 years where I was in and out of the hospital constantly. So I never feel we should go back to being the old us, because the old us was scared. The old us we're talking about is the one that, could climb the mountain, the one that was just laughing all the time and loving their life before they got sick. The new you has to embrace the new life you have and start setting goals for yourself. There are ways to do things that you can accomplish a lot of these goals. There's certain things you might not be able to do, but you set a different goal then. I started traveling the world after I got diagnosed because I was afraid I wasn't going to be able to see it. But I had to slow it down because I couldn't walk too far. I had to take breaks, but I did it. You can too. So I'm going to do a video for you guys. This is even good to do for caregivers of people that have chronic illness. But I'm going to give you guys a meditation video of how to detach from your attachment to your disease, your disorder. And we'll go from there. And I hope some of you will share your stories too and help other people learn how to function better when we're diagnosed with a disorder or a disease that completely alters our whole life. And I know for me, my biggest value in all of this was, my biggest lesson, being diagnosed with the disorder that I have. I was grateful afterwards. I was angry. I was upset, but then I was grateful because it made me really live my life, and it made me focus and prioritize what was important. When you're given like an expiration date, you want to crunch a lot into a small time frame. And then when you realize they've extended it, you slow it down a little bit. But none of us truly know what our expiration date is. But sometimes when a doctor hands you one, it's a weird feeling. So my next video will be a meditation on how to detach from your attachment to your chronic disorder. Thank you.